listening to the Pharmacy Podcast Network.
The Cardinal Health Counter Talk podcast, in collaboration with Pharmacy Podcast Network, is for independent pharmacists to learn about the state of the industry, innovative services and solutions, and the future of pharmacy. Join me, your host, Jason Callori, for conversations with pharmacists, Cardinal Health leaders, and industry experts, sharing best practices, discussing industry trends, and showcasing Cardinal Health products and services. You can subscribe to the Cardinal Health Counter Talk podcast on Spotify, Apple Podcasts, and wherever you listen to your favorite podcasts. Hello, everyone, and welcome to the Cardinal Health Counter Talk podcast. I am your host, Jason Callori, and today we are celebrating National Pharmacists Month, and we will be highlighting some great stories from pharmacists all across the country in celebration of National Pharmacists Month. Today, we are talking with David Dingman, a pharmacist owner of the Medicine Place and Fulton Medicine Place in Central New York. He's a graduate of Albany College of Pharmacy and has been practicing pharmacy. This is his 30th year in pharmacy, which is pretty cool. Welcome to the show, David.
Oh, thanks. Thanks for having me. Excited. Yes.
So tell me a little bit about yourself. Tell the audience and the listeners here a little bit about yourself, and what's been going on in your pharmacy world. Well, first of all, happy 30th anniversary. I think that's amazing.
Thank you.
You've been in pharmacy for 30 years. Has it does it feel like 30 years, or has it gone pretty fast?
It goes really quick, really quick. And the profession has changed dramatically over those years. Yes, very much. As you reflect back when you say it and you start getting the invites for the reunions and stuff, you tend to do some self-reflection, and it takes you a while when you have that body of work to kind of go over. It takes a little time.
So what got you into pharmacy? Was this a family thing? Obviously, you've been in the practice for 30 years. You have two successful pharmacies that you're running out of New York. By the way, I'm from New York, so that's a proud moment for me. So good job on you for running two pharmacies out of New York.
You're still representing, yeah.
Still representing, that's right. Love that. So what made you get into the pharmacy, way back when?
Well, it was the mid 80s, and I was, going through high school and start being faced with these decisions coming to the end of your high school career. What am I going to do after this? I knew college is what I wanted to do, but at the time I was a stock boy for a regional pharmacy chain called Phase Drugs. And
Phase Drugs. Can't say I remember that one.
That's that was before the old Brooks and Eckerd and all that. But Phase Drugs in Central New York. And that's back when people used to change their own oil, and we used to stock the oil and the end caps every weekend. So it was after school and weekends. And I remember the pharmacist, great guy, used to bring in donuts for us stock boys every Saturday morning. And we thought that was the best thing on the planet. We looked forward to going to work on Saturday morning, knowing the pharmacist was going to bring us some donuts. So, that interaction kind of, as I'm stocking the shelves and I'm looking back there, I said, he's not exactly killing himself back there. It's not 100 degrees and he's not breaking his back. Maybe that's something I want to look into. Boy, could I couldn't have been more wrong about what he does and the value that he was bringing to the community at the time. But it just caught my eye from the working around him and looking back there to see him interact with patients, and it just spurred the flame for me to look into it, pursue it, and I ended up applying to college and was accepted, and here I am 30 years later.
It's pretty amazing. It all started with a box of donuts.
Saturday morning donuts every week.
But that's pretty cool, because you didn't really know anything about pharmacy at the time. You went in doing some stocking and you just kind of visualized and saw what was happening, and it just kind of spurned that fire in you, as you said. What was it that actually you saw him doing? I know you said he's interacting with patients, he's doing some stuff behind the counter, which at the time you thought wasn't, it didn't look like he was killing himself. But what was that main deciding factor that was like, okay, I think I can make this a career?
Yeah, I think it was him being a solution-oriented individual. Everybody that came up to that counter had a question, a concern, a problem. And then by the time they left that counter, that question was answered, the concern was managed, or the problem was solved. And to be to be that inside of a community appealed to me, that you can help others and be able to solve these problems and be a resource for others to go to look for advice and be able to truly help individuals. Yeah. It just struck me as a young 16, 17-year-old man. It struck me, and that it was that very thing that he stood behind that pharmacy, and whatever came his way, he was ready for it, and was able to solve it. He was focused on the solutions. Yeah.
So did you kind of use him as a sounding board at all? Or you pretty much, because you were so young, you kind of work from afar, just visualize, maybe that could be you behind the counter one day? Or did you
Absolutely.
did you have conversation with him and really kind of, use him as a sounding board to find out more?
Absolutely. Once you have the soft introduction and he's kind of taking care of us stock boys, I started to ask questions and went through the application process, and he was a tremendous resource all the way through college.
Wow, that's great.
As I came back as an intern, I'd work with him, and he was the one that spurned the light and kind of sparked the interest, but he was also the one that kind of molded me throughout the years and helped me through my schooling years. And he's since retired now, but I consider him a tremendous asset and friend to help me on my path and help me make such valuable decisions at such a young age, because it's a tough one. As my children are older now and they're going through the process of what do they want to be when they grow up, and what do they want to go to school for. I feel very fortunate that I was put on a solid path at that age and able to pursue the career I did and realize the potential that I have.
All right, so kind of a two-part question for you. So your mentor, I'm sorry, what was his name again?
Tom Goss.
Okay, so your mentor, Tom Goss, what do you think his best attribute was as not only a pharmacist, but just a business owner? And then fast forward to now, 30 years in, what do you think your favorite part about being a pharmacist is? And what is your best attribute that you think you have behind the counter?
Well, he had a tremendous patience. I guess the best attribute, we're kind of going off script here for what I'm prepared for, but I like it. He listened to comprehend the problem as opposed to just respond. Okay. So, and there's an integral difference there. And he taught me that. He says, when you're listening to somebody, you gotta hear what they're saying and also what they mean, as opposed to just listening to respond to the question. And that was a very valuable lesson for a young man to learn. And it helps you, professionally, personally, and throughout life in general, I thought. Yeah.
So now if you kind of mirror yourself to that and kind of reflect back, now being 30 years in, what do you think your best attribute and quality is? And pretty much, what is your favorite part about being a pharmacist?
The people, they come in and so willingly are willing to accept you as a person that can bring value to their life, to their problems, to their issues. So willing to bring you into that circle. It's cherished, because it takes a lot, especially in today's environment, to have somebody come up to you and listen for your opinion, because usually they have their own formulated and they're going to stick to that.
Yeah. But
for them, I tell all my interns and all my new graduates and the young pharmacists that I hire, you have to earn respect. You can't demand it. And these young professionals are coming out of school with their PharmD, and they've been propped up and told that they're these health practitioners and they're doctors, but that doesn't mean anything to the patient. And until you listen to them and work with them, you cannot kind of pontificate and dictate. You have to work the problem with them. It's very important.
Yeah, that's a common thread that I've heard. A lot of, young folks coming in and, kind of wanting to get that respect immediately, just based on, maybe some college experience they've had. But I mean, it's a whole nother animal when you get behind the counter and you start. And to your point, each and every community that you work in, it's different. So you have to be able to adapt as well. Adaptability Can you talk a little bit about adaptability and how important that is in pharmacy?
Well, it's as a pharmacy owner, it's integral.
Yeah.
You have to be in touch. The small villages and cities that I work in, you have to be in touch with City Hall and what projects the community is doing to make yourself available to help in any way that may be needed. So, we all sponsor Little League teams and Pop Warner teams, and that's great and that's fantastic. But having gone through practicing in my hometown where I grew up and having raised 3 children of my own through there, where they played sports and they've been in the band, and I've been coaches and I've been on boards and I've done these things. You weave yourself right into the community, and then people will seek you out. They say, hey, he's just like us. He's over here coaching. He's rooting his kid on Friday night lights at the football game. We're no different, but by becoming part of the community and getting involved with a more of an elbow to elbow thing, cleaning parks with the Lions Club on the weekends, you become more approachable, and people are. When you let your guard down, people will come in.
Love that.
Yeah.
So what is the one piece of advice you would give to someone who wants to become a pharmacist?
I would go back to the listening. That was big for me. To learn how to listen is very big. And once you graduate, the school does a fantastic job of making you a clinician and a practitioner and a healthcare provider. But I'm afraid that they beat some of the human element out of you. I would stay in touch with yourself and to be a good citizen and find a way to integrate that knowledge and that possibility of what you can bring to the community on an even keel level, rather than expecting everybody to come up to your counter and genuflect. It's just not going to happen. But to stay humble, to don't complain, work hard, and things will work out. If you take care of your community will take care of you. And some of the big box retailers, they get you filling 400 scripts and doing 100 shots a day, and you get burnt out pretty quick. But if you take care of the community and do what's right for whoever's standing in front of you, it comes around and they end up taking care of you.
I love that. It's not so much about, I think when you have a tendency to start your own business, obviously you want your business to thrive, you want it to grow, you want to do well, and you want to focus on that business. But I love the idea of focusing on the community that you're a part of, and the business will come. So
yeah, if you build it, it will come. Sometimes you're like a monkey dancing on a razor blade. Yeah, you really are. It's tough. It's tough to balance that. The business owner and the health practitioner. It's tough to balance, to find a harmonious balance there. But I think that's what the years in the business have helped me with. I have a tremendous staff. I enable them, both the pharmacist I have and the support staff, the technicians, the clerks. If you're able to empower them and enable them to do more and give them job satisfaction as part of the team, rather than just say, this is your job, you stay over there. You got to do it as a team. And that's, they find more value in coming to work, and they're happier. And that conveys to the patient as part of the team.
Absolutely love that.
Yeah.
All right. This is probably gonna be your toughest question here, and your last one today.
Sure.
And like you said, you've been doing it for 30 years now. Can you share your favorite patient store or experience you've had as a pharmacist? Your favorite patient story, I should say. Maybe your. I know it's gonna be hard to pick out, but if there's
it really is. Some make you laugh, some make you cry. Yeah. I have two in particular that really, and the story's pretty much the same. They were younger than 10 years old, both diagnosed with leukemia.
Okay.
And they come in, and to see the mom and the dad come in with the deer in the headlights and just getting that unbelievable, terrible news. And they got the little one was a boy and one was a girl. Mm-hmm. And they, to go through the process of becoming part of the plan, the treatment plan, becoming part of the process, learning as I went. As a retail pharmacy, you're not exposed to the inside clinical treatments as much, but learning as I went to become part of the team so I could support them as they had questions, to raising, doing fundraisers locally to help them, to support them through the Make-A-Wish Foundation process, and seeing them thrive. These young warriors thrive through the fight, the biggest fight that anybody could have. Was a tremendous value to be welcomed into that environment. And now 15 years later, to have them come in with a family of their own and fill the positions for their kids.
Wow.
Doesn't get any better than that.
That's amazing, man.
It does not get any better than that. That's, to be part of that journey and see it from the lowest of lows to now, I consider it the highest of highs, to see the win and have them still coming to me is I'll never let that go. That's what keeps me going.
Dude, that's absolutely incredible and very inspiring, I think, to a lot of people that are listening.
Thank you.
Yeah, I mean, what can I say, Dave? Thank you so much for what you do. And I think, being, National Pharmacists Month, I think we all listening can, thank for you and other pharmacists that just for that story you told are doing exactly that. So, thank you, David, again, for your willingness to participate, taking some time to talk with us, and just keep doing what you're doing. I think that last story was amazing. And I think you have a lot of good advice for a lot of different students coming into the fold. And yeah, I think definitely use you as a sounding board. We really appreciate it, man.
Yeah, I have so many tremendous colleagues, and I'm humbled to even have the ability to share my story, because I've been molded over the years by my colleagues and others that have done it before me and shown me the path of how to do it and how to do it the way that I found a way to do it. But congratulations to every professional out there to celebrate this month, and happy to be part of the profession.
All right, David. Well, thanks again for hanging out here with me on the Cardinal Health Counter Talk podcast, and we will talk to you very soon.
Appreciate it. Thanks. Have a great day.
Thanks. Hello, everyone, and welcome back to the Cardinal Health Counter Talk podcast. I'm your host, Jason Callori, and today we continue our important series during National Pharmacists Month here in October by highlighting some incredible pharmacists and their personal journeys. Today, we welcome Glenn Perreault, owner of Colonail Pharmacy from New London, New Hampshire. He has worked there since 1993 until he purchased Colonail Pharmacy back in 2010. Glenn is a New Hampshire native and graduated from Massachusetts College of Pharmacy and Health Sciences. Welcome to the show, Glenn.
Thank you. Thank you for having me.
So how's New Hampshire treating you this time of year?
New Hampshire is a little chilly this time of year. We got down into the 30s a couple nights ago, and the leaves are changing nicely. It's a pretty time of year to be here in New Hampshire.
I was going to say, is that kind of an early fall switch for you guys?
It is a little early, yes, absolutely.
All right, well, tell us a little bit about yourself before we kind of, take a deep dive into some of the other questions I have for you. Tell us a little bit about your background, about your education, ultimately, why did you decide to become a pharmacist?
Sure. So, like you mentioned, I've been a pharmacist for 40 years. I've been an independent pharmacist for about 31 of those 40 years. Started out with a Hannaford chain called Welby Superdrug, and when they were purchased by Rite Aid, the writing was on the wall, and so I made the switch to independent, and haven't regretted it one bit. I'm pretty active in the community up here. Still volunteer for the high school for their winter outing club, and do several winter camping trips. So what made me decide to become a pharmacist? That was pretty interesting. I didn't know what I wanted to do out of high school, so I went to a community college and was able to still play sports. And the last semester of community college, my father says, "Okay, you ready to go in the Navy now?" And that was a rude awakening. The way I got into pharmacy was absolute pure luck. Had a really good friend from high school whose father owned a pharmacy in Haverhill, Mass. I was with him and visited his father at the store. became really intrigued. And speaking to him, he said, well, you got to be really good at chemistry, which was my passion, which I really loved to do in high school. And so his son says, well, I got to go to Mass College of Pharmacy to take a final. Why don't you come down with me? So I hitched a ride with him down to Mass College of Pharmacy. And, I'm just a wide-eyed New Hampshire boy walking around the foyer. And someone from the admissions office saw me, asked me what I was doing there, and invited me into his office for a chat. And so I tell the story how I talked my way into pharmacy school. And I had the interview before I did the application. And that's how I ended up going to Mass College of Pharmacy and really, loving pharmacy. I had a really great mentor as a pharmacy student back in Salem, New Hampshire, who really gave me a passion for independent pharmacy.
Wow, that's quite a reverse of fortune there. You're just kind of, thinking, oh my God, I'm going to end up in the Navy. And you start working at the pharmacy and you're like, wow, this is kind of what I want to do. Going back to that story, what sports were you playing? Did you think like you were was your passion to play sports and maybe turn pro in whatever you were playing those days?
Oh no. I mean, back then I was 6'1" and playing basketball. So
okay.
I know there was no my favorite varsity sport in high school and one that I played very well was football. But the small junior college didn't have a football team. So basketball it was, and truly enjoyed it for 2 years, and met my wife, who was the cheerleader for the team. Yeah.
So all that stuff happened. You ended up working at this pharmacy. Tell us a little bit about, because this is something that's been a recurring topic, and it's the mentorship. Tell us a little bit more about your mentor, what he's meant to you, and about the importance of mentorship, especially, I think, in pharmacy or becoming a pharmacist, and more importantly, becoming a pharmacy owner.
Yeah, so there was a small 4 or 5 store independent chain in the state of New Hampshire called Hospital Pharmacy. He was a brother of the owner, and he was very, very passionate about independent pharmacy, kind of took me under his wing. And as a student at a really small, primarily dispensing pharmacy, I did everything there from deliver prescriptions, filling prescriptions, and cleaning and vacuuming, the pharmacy.
Yeah.
He introduced me to compounding, and I believe that we were either the first or second pharmacy in the state to have an online pharmacy computer system.
Wow.
But he was great. He taught me everything from some of the business aspects to buying. He was the purchaser for the small chain, and it was my responsibility as a student to divide up the order and package and label. Back then, we did all our ordering direct to manufacturers, and yeah, I did it all. Strung Christmas lights in the winter, whatever had to be done, and truthfully, I have that mentality now. Whatever it takes, whatever you got to do.
So have you kind of passed it forward and, into your years now as a seasoned veteran of the pharmacy business? Have you found yourself being a mentor for anyone in particular?
So no one in particular. I currently have a very young pharmacist. He's been out of pharmacy school for less than a year. He's great individual. I don't know how long we're going to have him. His wife is doing a residency at Dartmouth Hitchcock Medical Center, so I know I got him for at least 3 years.
Yep.
But we're hoping to put that passion in him and hopefully find a successor.
That's awesome. So that really brings us well into the next question here, was just, what is your favorite part about being a pharmacist overall? I know it's probably hard to pick. I think when I ask this question, a lot of people could go a lot of different directions, but usually there's an aspect of being a pharmacist that does stand out. So Glenn, what is yours?
Oh boy, that is really tough. I don't, it's really easy to give like a canned response, like, "Oh boy, I love helping people." But
Yeah.
I mean, I think anyone who goes into a health profession, that's their idea. I just think it's so I love independent pharmacy more than just pharmacy. Um, you can tailor your business to meet the needs of the people on the fly. There's no permission, there's no lengthy process. Um, I like the fact that I can hire people who have the same philosophy that I do, that if you take care of your patients and clients, then they will take care of you. I love being the go-to in the community, regardless of what it is, whether it's a health-related problem or just volunteering at ski swaps or different events in the community.
So it sounds like you really just love not only the people, but the flexibility. You make your own, kind of make your own decisions. We've talked about this before, how being an independent pharmacy allows you to kind of, jump over or skip through the red tape. If you want to make a decision on the fly that's best for your pharmacy and your community, you can do it like that.
Yeah, exactly. So, I recognized several years ago that, if you were a pharmacy that counted pills and threw them in a bottle, that you weren't going to be a pharmacy for very long. And so, had the opportunity to just begin shifting the focus of the pharmacy while maintaining our patient population and our prescription clientele, but shifting over into other clinical services. The first one was immunizations, just like everybody did. But we've expanded now into point of care testing. I have several, protocols in place with physicians that allows me to test and treat COVID, flu, and strep, and want to expand into RSV. And it's just being able to, like you said, change on the fly, implement new ideas without having them, approved by a higher board or whatever.
a higher power. Yeah,
exactly, a higher power. Exactly.
Totally get it. Well, if you could give one piece of advice to someone who wants to become a pharmacist, who's maybe looking to get into the business of pharmacy, and this could be, whether or not they're deciding to go into school to become a pharmacist, whether or not they want to go chain versus independent, or just, any sort of advice that you would give them overall, what would that be?
So, hindsight being 2020, and being a guy who started as a chain store pharmacist, my biggest piece of advice would be, don't be lured by the chain store. Don't be lured by the, the big dollars that they're going to flash in front of your eyes. They are going to demand a pound of flesh for those dollars that they give you. I would seriously consider, if it's not a clinical role at a medical center, look into independent pharmacy and, expand the clinical services in that independent pharmacy if that's what your passion is, to be a clinical based pharmacist. That would be my advice, is practice at the top of your license. Anyone can throw pills in a bottle, but you didn't go to pharmacy school for 6 years to just throw pills in a bottle.
So being in the industry so long, Glenn, I have to ask, what has kind of been the prevailing theory that you have seen from either new students coming out of school to become pharmacists? Are a lot of them willing to do more than just throw pills in a bottle? Are they leaning more on technology? What's kind of that prevailing that prevailing trait that you're noticing from new pharmacy students coming out of college and into the real world as a pharmacist?
So I actually see a mix. There's not one demographic. you're always going to see the person who comes out and they're going to chase the big dollars. They have large student debt. They want that high hourly wage, and they're willing to sacrifice their personal life just to, chase the dollars. However, that being said, the last several NCPA conferences that I've been to, I'm seeing a lot more students coming out who want to own pharmacies, who want to expand clinical services in their pharmacies. And that's super encouraging to me. I mean, not only as an older pharmacist who's looking to, have somebody continue the legacy here of this independent pharmacy, but just for pharmacy in general. We are, it's a cliche, but we're the number one. We see patients more frequently than any other area of healthcare. We make primary care decisions every single day. A lot of the public doesn't consider us primary care providers, but when they come in and they say, hey, what can I take for this allergy? What can I put on this poison ivy? That's a primary care intervention. And we're seeing a lot more of that, and we're seeing a lot more pharmacy students who are coming out and want that aspect of being a pharmacist rather than just the count, pour, lick, and stick.
I love that. I love that you brought that up, because I think that's one of the most important aspects in pharmacy that we have today that we're seeing is being, like you said, more than just a pill filler, obviously being that go-to person in the community, that beacon of trust and accountability. And I love that you said that. So thank you so much for that, which brings me into my next question here. Share with us your favorite patient story experience that you've had as a pharmacist, whether it be a family that you've helped, whether it be a specific patient, whether it be an event that you helped put together and saw the community come together. What was that one or a couple moments that you've had in your past that really stands out?
So, I've spoken to before different community groups, Council on Aging, Parkinson's groups, men's groups, but there was one event that happened here in town back in the mid-90s. We had a horrific ice storm here. It shut the town down. The National Guard came in, would not allow anybody in, anybody out. We had lost power. Colonail Pharmacy, we went out and we purchased 3 gas, portable generators. We had 1 telephone line that didn't go through our system. And we stayed in this pharmacy and we hand wrote labels and filled prescriptions by Coleman lanterns. And so Colonail Pharmacy, New London, is between 2 exits on Route 89 in New Hampshire, between exit 11 and exit 12. Okay. And at the top of the hour, we would meet patients at the park and ride off of exit 12. And at the bottom of the hour, we would meet patients at this little local restaurant called the Flying Goose. And we would deliver patients. We would deliver patients' prescriptions to them, to those 2 locations. And we operated that way for a week until they cleared enough of the trees, restored enough of the power lines to let people come back into town. And I think, I'm patting myself on the back here, but, not only is that a testament to Colonail Pharmacy, but I think it's a testament to independent pharmacies, because there are pharmacies like that have those adversities all over the country that do things like that.
Well, Glenn, when you say ice storm, what are we talking about here? We're talking about you're talking about like hail, or
so we're talking. Yeah. No, so our temperature was right on the edge between. It was a freezing rainstorm that put about a half an inch of ice on everything. Wow. We had trees snapping in half. We had telephone poles snapping in half. Yeah, the roads were covered by a sheet of ice everywhere you went.
So wait, so then how did you guys get those prescriptions to one, the park and ride, and then to the other side at the restaurant? Were you guys driving in this?
We were. So fortunately, Newport Road and Main Street in New London is a state route. So it's a fairly wide road.
Okay.
And so we had an all-wheel drive delivery vehicle.
All right.
As many people do in the Northeast. And we just the National Guard help us keep an alleyway open to both ends of town. And that's basically the way it was. We coordinated everything with the National Guard and emergency workers so that we could do our deliveries at the top and the bottom of the hour.
Dude, that's pretty amazing, Glenn. I mean, I know you said you didn't want to really pat yourself on the back, but that's worth patting yourself on the back for.
It was, and it was a lot of fun, actually. It was, it was a lot of fun.
How did your patients react to this type of commitment and service? Oh,
they were incredibly appreciative. Between the doctors in town, we would send our delivery driver when they weren't driving for prescriptions. They would drive over to the two main medical practices in town and pick up any documents. Back then you had to have all the narcotic prescriptions written on pieces of paper, and so they would pick up the documents and they would bring them back to the pharmacy when they weren't delivering prescriptions. It was very well received. It was we received a lot of accolades for that.
Oh, that's amazing.
Yeah.
Wow. I don't think we could really go any further from there. I absolutely love that story. Glenn, I really want to say thanks to you for joining us for our show today, providing so much valuable information for our independent pharmacy listeners. Everybody out there, please continue to celebrate American Pharmacists Month, and thanks for subscribing to the Cardinal Health Counter Talk podcast. We hope you enjoyed the show and listening to Glenn's incredible stories here. If you haven't yet, make sure you subscribe and download the Cardinal Health Counter Talk podcast wherever you get your podcast. See you soon on the next episode. Take care, everyone. Hello, everyone, and welcome back to the Cardinal Health Counter Talk podcast. I'm your host, Jason Callori, and today we are continuing an important series during National Pharmacists Month here in October by highlighting some incredible pharmacists and their personal journeys. Today, we welcome Lori Wood, clinical pharmacist at Community Pharmacies, which is an independently owned chain of pharmacies in the beautiful state of Maine. Lori is a 2014 University of New England graduate from the College of Pharmacy and a New England native. Welcome to the show, Lori.
Thank you, Jason.
So up in Maine, what part of Maine are you from?
So I'm originally from Westbrook, which is right next to Portland, but I currently live in central Maine, just south of Augusta.
South of Augusta, okay. Yeah, we were kind of talking before we started recording this on how much I love Maine. It was beautiful when visited there and Acadia Mountain and seeing the sunrise and sunset. It's really beautiful there.
I can't agree anymore.
Well, yeah, I mean, you've been there all your life, but tell us a little bit about yourself and what made you want to become a pharmacist? We always kind of like to ask that question, kind of take a little bit of a deep dive. And, was there something growing up, or is it something you just kind of fell into, or did you always know you wanted to become a pharmacist?
Well, when I was young, my mom used to take me to the grocery store with her. She was a single mom not single, but stay-at-home mom of 5. And I was the youngest with a generous age gap between me and the next group. So there's the 4 of them and then me. So I was her little tag-along buddy with all of her adventures. So she would take me to the grocery store and kind of drop me off at the blood pressure cuff at the pharmacy, because that's where I would sit quietly while she got her shopping done.
Okay.
I found it fascinating to watch the adults in the white coats going back and forth, doing their routine, but more specifically, being the person that people would go to ask their questions.
Well, that's pretty cool. So you were pretty impressed upon at a young age.
definitely. There's not a lot else going on up here in Maine.
Well, I mean, when you kind of, what was the thing that you saw besides, being the go-to person at the counter? Was there any other part of the pharmacy that you were looking around and observing that kind of fascinated you?
As a child, that was really the memory that stuck out, was the people just going and asking to speak to the person in the white coat.
Mm-hmm.
And then they would have recommendations. Sometimes they would take them out into the aisles and show them exactly what they were looking for. Sometimes they asked me to move so they could take a blood pressure. But they never really minded my presence there.
Okay. So do you feel like as you got older, do you feel like, some of that imparted on you to become a pharmacist?
So I would say that probably my junior year of high school, my father started asking, like, what are you going to do with your life? You could be anything. And I really thought back, and I took an aptitude test, and it said that magic word, pharmacist. And it made me really think about how I wanted to live my life. And, I grew up with a stay-at-home mom. So I knew that having a family was going to be something important to me. And as I explored pharmacy as a profession, some of the entry-level opportunities were pretty flexible. And I knew that would be important to me, but I also wanted to make sure that I was challenging myself mentally. And the more that I explored pharmacy, it just seemed like a great fit for me.
Did you have a kind of a mentor as you made your way up the ranks and, to becoming a pharmacist? I think mentorship is something we've highlighted here in this series, and feeling like it's pretty important for, pharmacists to, guide younger pharmacists and different people coming out of school with questions and trying to find those answers and get some guidance as to where they should go next. Did you have a mentor in your life? I mean, it might not have even been a pharmacist. It could have been, like you said, it could have been your mom, your dad. Was there a mentor that kind of helped you along your path?
So mentors, I would say that I had an English teacher in high school that really pushed me to explore the opportunities. When I was in high school, there weren't colleges of pharmacy in Maine. And as I was graduating, UNE was opening their doors to their first class of students for the pharmacy track.
Wow. Okay.
I ended up being the second class.
Wow, you were the second class ever. You were the second class ever in that college of pharmacy?
Correct. Yeah.
Oh, interesting. Okay.
So Maine opened 2 pharmacy schools at the same time. One was in the South, and that's the one that I attended. And one was in the North, Bangor area, Husson. And I would say that, my high school teacher pushed me to pursue new and maybe scary opportunities. But when I got into pharmacy, so because it was all pretty new and we all helped lay the groundwork in the state for how to become pharmacy educators and how to have successful classes of students, I would say that there's these things called practice experiences. There's introductory and advanced when you're actually in the pharmacy program. And when I got into my advanced practice, I met someone named Amelia, and she's actually very wonderful.
Okay.
I would say that she is now still my mentor and colleague. She works with community pharmacies as well in the main office. And she was really a pioneer for the state as far as legislature and practice goes. So she pushed me in my last year of school to pursue a residency. And basically a residency is what we say is 5 years of practice crammed into all 1 year.
Oh, wow. Okay.
So the community pharmacies offered me a job before I was even done with school. And I had to decline with the caveat that I wanted to go away to a more progressive state and learn what I could to bring it home to Maine.
Okay. That's a smart move, I think, for sure.
And Amelia definitely supported me, even though she wanted me on the pharmacy roster, if you will.
Yeah. She wanted you to stay, but yet at the same time, she wanted you to go and learn as much as you could.
Right. And I did. I went away to Pennsylvania. I practiced at an independent community pharmacy that partnered with Wilkes University and St. Luke's University Hospital. So part of that experience was that I was seeing my own patients at St. Luke's, making recommendations to the doctors that they would listen to and bring back to the care team and say, yes, that's an appropriate recommendation. And I would have a compounding lab. I would do long-term care pharmacy. I did travel medicine clinics. And I did some legislature days. I also precepted students from Wilkes University and Temple and a couple other places during my first year out as a pharmacist.
Wow, talk about like a full, just a full crash course in everything pharmacy, and I mean, I think that's probably one of the, I don't think we've heard that yet. Kind of doing a, a crash course like that, almost a, if you will, a smorgasbord of different pharmacy tasks that you got to learn. Like you said, cramming 5 years of experience into 1 year. I mean, that sounded pretty intense. I mean, how has, in your opinion, so you said you were the second class. How's the evolving education gone in New England since that second year that you were there?
So I think there's been shifts. There's been peaks and valleys as far as filling the classes completely and then maybe not filling the seats in the schools. I think you can see that in the market as well for pharmacists. I think the bigger conversation here is what the graduates have been able to accomplish, the ones that have stayed in Maine.
Yep.
So for an example, I had mentioned that I wanted to go to a more progressive state and learn how they got to a more progressive place in their pharmacy practice and their legislature, because legislature really can be a barrier to healthcare professionals. Well, when I started school, pharmacy school, I was the second class, and pharmacists didn't immunize. Yeah, so the professors that came from around the country to open these schools, they brought their knowledge from around the country and really catapulted the profession forward. So we went from the least advanced state to one of the most advanced. And actually this year, legislation was passed during this past session where pharmacists in Maine can immunize under their own authority for any adults 18 and older, as long as the vaccination is FDA approved and recommended by CDC's ACIP.
Wow, that's incredible. So there's been, I would imagine there's been quite a boost of immunizations now that are done, all throughout the state of Maine.
Well, I think, yes, but we're now seeing it at a more accessible level. So Maine, the entirety of Maine is considered rural healthcare. So to be able to have a healthcare professional available for a patient to, maybe it's 10 miles into the pharmacy, for them to be able to go and receive free medical advice and potentially free immunization services is key here.
Oh, that's amazing. No, thank you for that insight. I think that's really interesting. Again, I mean, I learn always something new, especially from a state to state type of basis, when talking to different pharmacists and all the ones that we've talked about, for this series. Really interesting insight there. I kind of want to bring it back to you in particular, Lori. With all that you've talked about here so far, just what is your favorite part about being a pharmacist?
Education, I think. So in my current role, I'm one of the most easily accessible healthcare providers. I'm clinically trained. and I'm practicing in the community setting, which is kind of unique to be a clinical pharmacist practicing at what some people used to call retail pharmacy.
Mm-hmm.
But again, that's part of what I like about it. I like to be that accessible, free point of care. So this allows me to use my knowledge and my skills to answer patient self-care questions, as well as to direct them to other healthcare professionals when their inquiry is more suited for a different discipline. So if it's something that is out of my scope, I can say, this is who you need to see, and you need to try to get in now.
Yeah, kind of building on that. So you said education is kind of your biggest focus as far as your relationships with physicians in your area. How has that evolved over the course of time?
So in my practice setting, we have some rural healthcare centers. We have Sheepscott Valley Healthcare Center and Richmond Area Healthcare Center. And those providers, they don't hesitate to pick up the phone and call in. And at my pharmacy, when you call in, oftentimes I'm the one who answers the phone.
Okay.
And I say, hi, how may I help you? And they say, can I talk to the pharmacist? And I say, you got her. And they'll proceed to have this discussion. And to be able to be part of a patient's care team where we can coordinate so closely, even though we're not physically in the same location, is pretty incredible.
So that actually brings me, really easily into the next question here, because you talked about education, you've talked about kind of the strides that has been made in Maine, and some of the challenges as well. Your favorite part about being a pharmacist, you said, is education. So when we talk about that, what is the one piece of advice you would give to someone who wants to become a pharmacist? So, you have that educational background. You obviously have a almost kind of a mentorship side to you that you like to kind of guide and talk to folks and, give them the right direction to go. And so what is that one piece of advice you would give to a new pharmacist or someone thinking about wanting to become a pharmacist?
Yeah, I would say
Lori's like, there's so much advice I could give.
there really is. There certainly is a lot to think about. This profession can really take you anywhere you want to take it, as long as you're putting the work in.
Well, I guess maybe to make it easier, think about it like this. Would your advice be wanting to give to someone that's about to go into school and what to expect? Or would you feel like it would be someone just coming out of school? Where do you think like you would lean?
I think I could do the best from the beginning. So somebody thinking about going into school,
Okay.
I would say that this career takes dedication and passion. And if you Google pharmacist salary, you'll see pretty dazzling numbers.
Mm-hmm.
But as with anything, if you don't enjoy the work, it won't be worth it. So my advice would be to get as much exposure to the profession as you can before you're solidly into pharmacy school.
Okay, so you mean, working for different practices and, different settings. Okay, great. Yeah. Yeah, that's good advice. I think, the most experience you could get under your belt before even becoming an owner, I think, or whether you just want to stay in, like you said, like a community setting, I think is extremely important. Let's see here. Okay. I'm sorry, please edit that out. All right, so last question here, Lori. Can you share your favorite patient store or experience you've had as a pharmacist? So I think this is the best part of these interviews that we've been doing, as far as talking to the different pharmacies and trying to figure out what that story is. What's the most impactful story that you've come across? And it may not have to be something recent, could be something from a long time ago, but what is that patient story or experience that you have that has just resonated with you over the course of time?
Okay. So I did prepare something for this question because this took a lot of thought. A memorable encounter for me was during the later months of 2021. There's a little bit of background necessary for your understanding here. Okay. There were vaccine technologies being put to use in the United States for the first time on a notable level in early 2021. COVID. Mm-hmm. people were hesitant about the mRNA technology in these vaccines. And I saw an educational need and opportunity and took it upon myself to use the skills that I've learned through school and daily practice to do my own independent research on the technologies so that I would be better educated, but also confident in explaining it all to my patients. What I found when I looked into this was decades of research from other countries. I recall finding an article that was German, and it was published years prior, explaining the mRNA technologies. My first comfort was that the technology wasn't new. It had been around and studied. I ended up translating that German article into English myself. That way I could read it and understand it and use it as the tool to educate my patients who ended up inquiring. My favorite part, I have a regular couple who are patients at my practice site, and the wife is immunocompromised. They came in to seek my knowledge on the matter, and I was able to take 5 minutes to explain to them how the technology worked. I even drew them pictures to hear their concerns and provide accurate answers to their questions. I also let them know that vaccines don't prevent illness, but help give our bodies the best chance to quickly fight the illness off. I told them now that they have the information, they will need to decide what's best for their healthcare. Ultimately, they both decided to be vaccinated with the mRNA vaccines. And a few months later, the husband came in to tell me his wife had contracted the disease, and her doctors had told them that if she hadn't been vaccinated, her healthcare outcomes would have been dire. He wanted to thank me for helping them in an unbiased way to make an educated decision for their needs. And to see my practice help people have favorable healthcare outcomes is why I'm proud to do my job each day.
Wow, that's an incredible story. Do you still keep in contact with that couple?
Absolutely.
Yeah.
They come in every Wednesday night.
I was going to say they sound like they're regular customers.
Even if they don't need anything, they pop by to say hello.
Oh, that's amazing. And how is she doing now?
Immunocompromised, but living her life.
Okay. Well, they're very lucky to have you to help Lori. So we really appreciate all you do for the community.
Well, thank you.
Well, I want to say thanks to Lori for joining us here on the show and providing so much valuable information for our independent pharmacy listeners. Please continue to celebrate American Pharmacists Month. And thanks for subscribing to the Cardinal Health Counter Talk podcast. We hope you enjoyed the show. And if you haven't yet, make sure you subscribe and download the Cardinal Health Counter Talk podcast wherever you get your podcasts. See you on the next episode. Thanks again to Lori, and take care, everyone. Hello, everyone, and welcome back to the Cardinal Health Counter Talk podcast. I'm your host, Jason Callori, and today we continue our important series during National Pharmacists Month here in October by highlighting some incredible pharmacists and their personal journeys. Today, we welcome Manzil Panchal, owner, pharmacist, is a fellow graduate from Long Island University School of Pharmacy. He has over 10 years of experience in the field of pharmacy, working in a variety of settings from retail to hospital pharmacy. Manzil is originally from India and moved to the States in 2005. Manzil, his wife, Himanshi, has a 4-year-old son named Shayan. During his free time, he enjoys spending time with his son and playing sports like cricket and volleyball. He enjoys traveling and experiencing different cultures with his family every year. Welcome to the show, Manzil. How are you?
I'm pretty good. How are you?
Doing good. I hope I didn't screw up all those names too bad. But
You did right.
All right. Well, Manzil, tell us a little bit about yourself. You have a really interesting background. I did read your bio, and I did want to, leave it for you to discuss a little bit of your story in getting to the United States and how you became a pharmacist.
So I'm currently like the owner and pharmacist at East Norriton Pharmacy here in Philadelphia. Originally, I came to US in like 2005, as you said. Originally, I have a Bachelor of Pharmacy from India. And when I came here in the US, I was going through Long Island University for my master program. So I came in, and during the school year, I was kind of working as a part-time pharmacy tech during the independent pharmacy, where I came across with how the retail settings work here, because it is kind of different than back home and what versus here. So I kind of came to know that how the independent pharmacy has a greater influence on the patients, how they closely work with the patients, and which kind of makes me more interested into the career. And so I had an option after my master's to go for like a retail, or I can go with the industry to doing research. But since I was working in the retail industry as a pharmacy tech, I kind of came to know about knowing how it's kind of, pharmacies involves in reaching life with the patients and how they educate patients and, how they change their, life for being well-being. And it kind of makes me more interested to go grow my career into those kind of thing. So at the end, I kind of decided to go to become a pharmacist. And while after becoming a pharmacist, I kind of worked for a couple of chain pharmacies and worked for a couple of hospital pharmacies as well. But because I started my journey as an independent pharmacy tech, I kind of already wanted to go into as an independent pharmacy. So back in 2007, we opened our own pharmacy here in East Norriton, Pennsylvania, with ground up, with 0 patients, 0 script. And it was a tough journey. But after 5 years, it's kind of running successfully now, and it's like an amazing journey. And now I can see myself like as a better pharmacist after this many years. Like I can changing patients' life and creating impact in their life.
So going back to India, what were some of the biggest differences you saw in pharmacy from India to the United States?
So the main difference is the career. So, how here, like if you do accounting and after 6 months of accounting, if you decided this is not the career I want and you can switch to being a doctor or something else, we don't have an option like that. So based on your high school, it decides your career. And being in the Indian family, you have 3 options. Either you become a doctor, engineer, or you become a lawyer. So of course, doctor is too far for me. And engineering is something I didn't want it to do. So I end up being in the middle where being a pharmacist. So I started my career being a pharmacist. It's not by choice. It just, I kind of jumped into it because of my high school grades. So initially, yeah, of course, it was kind of challenging. And I was good with math and chemistry. So of course, it kind of interesting for me. But then since I started becoming pharmacist and started working in a different setting, kind of after spending like 12, 13 years being a pharmacist, now I just kind of loving it. But if you consider difference between that from India and here, it's just over there is not a personal connection you share with your patients. Like usually it's more like doctor and patient kind of a relationship, but not as a pharmacist and patient relationship. Here, it's like even for the small thing, my patient would call me and like, hey, Manzil, I have this cold. What do you think? What should I take? Over there, it's not like that. They'll call their doctor. So there is no a personal connection between pharmacist and a patient. Versus here, like their first choice is calling me, and rather than calling their doctor. So those are the different challenges have over here and versus over there.
Interesting. Next question I have is, why did you decide to become a pharmacist? But I kind of feel like you answered that a little bit. So let me change it a little bit. What made you want to become an independent pharmacy owner? Obviously, you worked in a lot of different aspects of pharmacy. You said you worked for some chains. You worked in India and then you worked here. You did a lot of different aspects throughout in the industry of pharmacy. But what eventually really moved you toward being an independent owner? And what is that? Are you glad you did it? What does it look like for you today?
So honestly, I feel like I made the right decision in my life to become independent pharmacy owner. So as I told you, right, I started my career in the chain pharmacies, and also I worked in a couple of hospital pharmacies as well. The only problem over there is I was so busy with my work, and because of the stringent SOPs and guidelines I have to follow at the chain pharmacies, I never had a time to pay a personal attention to my patients. It's all like fill the prescription, give it to them, and back to next patient. So it's just like I've never had a time to become a personal attention to my patients. Versus when And plus, when I was working as a pharmacy tech in independent pharmacy, I was seeing my pharmacists kind of spending so much time with their patients. They know by their name, they know their whole family, they know what they are taking. So even if they call, they're like, oh yeah, I know you're taking this, so don't take this. You have this particular drug you should take because of your other medicine. Versus in chain, nobody would know about anybody. So I always have a feeling that I know I'm doing pharmacist role, but I'm not justifying the role 100%. Like the only way I can justify if I kind of do my own. So that's the reason back in 2007, I decided, you know what, let's start something our own and see how it goes. So initially, yes, it kind of tough for me to build up my business but then since people starting knowing me and they're seeing how much service I'm providing, then how more I'm personable to them, then it started building up and it came to the level that now I'm running very successful pharmacy.
So once you made that decision and you went into owning your own pharmacy, what's been your favorite part about being a pharmacist ever since you became an independent owner?
So there are so many interesting things. So being a pharmacist, you can always kind of have an impact on people's well-being and their overall health. There's first thing people always ask me is why you open the pharmacy nowadays? Because there are so many chain pharmacies. How are you gonna survive? And pharmacies you just go to the pharmacy, give prescription, they fill the prescription. So what you make it different than those guys that make you survive? And I always tell them it's about the service, how I'm gonna treat you and how I'm gonna be more personable to you. That will make a difference and that will set me apart. And so if I give an example, there are so many families I have who kind of go into drug addiction and opioid abuse, right? So I kind of always I don't treat them as a drug abuser. I kind of always see them as a patient, and I try to counsel them what are the things out there you can try to get out from this, and I always counsel them what are the options or approach you can take to make your life a little bit better, and for the kids and what they should do to make their kids' life better. And there's so many families kind of came out from it, and those are the things I wanted to do more so to change their life. And I think that those kind of things kind of make me going every day more and more and to do changes in their life. So I think those kind of, when I see those smiles on their face, it just kind of make me going that, yes, you are in the right profession, you're making change in somebody's life.
That's awesome. All right. So you like you said, you went through all these different phases in your life, traveling, doing pharmacy. If you had one piece of advice that you can give to either a pharmacist or a student who's maybe thinking about becoming a pharmacist, or even a recent graduate who is now thinking about either going with a chain or working for an independent pharmacy, whatever it may be, what's that one piece of advice that you would give that person?
So one thing this many years, I've noticed that whenever we used to get students in the pharmacy, they have a different picture about retail pharmacy. And when they actually come in the market and start working, they're like, oh my God, this is not something I'm ready for. So I always give an advice to any new pharmacy graduate is look for your options. During your school year, when you get rotations, try to explore different options. Just don't focus on the retail side. There are so many different things you do. You can do hospital, you can do nuclear pharmacy, you can do counseling pharmacy, you can do industry, in research, or you can go to R&D, or you can do regulatory. There's so many options available. Try to explore each options and then at the end decide which one is the right for you. Don't just jump into the situation oh, everybody's doing retail, that's the reason I should retail. Look what you are good at it and which options kind of suits you more better, and try to explore your career into that path rather than just following everybody.
Well, that wants me to ask you, Manzil, so if you were, besides independent pharmacy and being behind the counter and helping patients, as you so eloquently put it, if you weren't behind the counter, what's your other favorite facet of the independent pharmacy business?
In the R&D. I was good at it.
Oh, R&D. Okay.
Yeah. Research, and I was good in chemistry and stuff. So I always wanted to do research on, drugs and stuff. So I could have, if I don't see myself being in the retail, I could have been in the research for sure. Yeah, definitely.
So like studying drug interactions and
Yes,
different types
and
of, okay, interesting. No, I love that. I always like to like hear like people's different different studies like in between pharmacy. We talked to a customer not too long ago who was really into not only studying, but studying different viruses and how they interact and some of the upcoming new ones. And again, probably along those lines of R&D to see
yeah.
like what's upcoming and how they can implement it in their
Yeah,
pharmacy. I think that's
like
great.
I have my background in like pharmaceutics a little bit, so that's the reason even in retail side I love compounding because it's just like something
Mhm.
different, and I challenge myself into something like okay, this new drug, dosage form I need to make. How would I make it better? So that kind of gives me challenge. But because of my pharmaceutics background, it's just kind of challenging, and it kind of gives me a different than my regular retail side. So that's the reason, like those retail and like compounding stuff, it kind of makes me more interesting. That's why I always say like it's research would be a better option for me if I don't be a retail independent pharmacy.
Before I ask you my last question here, I do want to ask you a question touching on for each and every pharmacist that we've interviewed here in this great series is who's been your mentor in life? Who's been your mentor on the pharmacy side? Have you had a mentor that kind of helped you guide you the most, whether it be back in India or here, that kind of helped you develop your skill set or gave you the best advice when you open your new pharmacy?
So I think when I gave my intro, I think I mentioned that like when I was in school, I was working as a pharmacy tech as a part-time in independent pharmacy. So that pharmacy, his name is Kanti Patel. He still owns the pharmacy in New York. That guy inspired me throughout his whole life. Like I've seen like how people admire him for every small thing, and he was so popular in the small town in Lynbrook in Long Island that everybody knows him by his name. And I always see myself like kind of becoming not as a, like just being a pharmacist, as a humble person. Like I would never see him being mad on anybody, so like jolly and happy nature. I would say like that person inspired me a lot throughout my life to become a pharmacist, and seeing him as an independent pharmacy owner, I always wanted to be like him. So kind of like that's kind of my reason. Like I kind of decided to go for, being an owner of the pharmacy.
That's awesome. Because it's always like to hear like your advice for young pharmacists, but some of the advice that you got, as you coming up as a young pharmacist too. So thank you for that.
Yeah.
What's your favorite patient story or experience that you've had as a pharmacist? I know there's probably a lot of lives that you've, touched upon and a lot of people that you've helped, but if you could pick out one specific story that has really made an impact on you, what would that be?
So, I mean, honestly, if you ask any independent pharmacy, they probably have like great stories to tell about their routine life. Like they have this patient, and there's for me, if you ask me particular, my best experience throughout my pharmacy career is the COVID pandemic. So during COVID pandemic, from like getting the mask, making the hand sanitizer to giving out vaccine, that's the experience which I got, which is like gonna stay with me throughout the life. So initially, I know there were like masks are like kind of hard to get. So we partnered with a couple of distributors. They were importing masks from overseas, and we are the only one in the area who had the mask that time. And then when there is a shortage of hand sanitizer, and then FDA released like the emergency guideline to make a hand sanitizer, I remember I was staying overnight in the pharmacy making hand sanitizer to give it out to the nursing staff in the neighboring hospitals because they didn't have any hand sanitizer. And during the vaccines, I was the first one in my county who got the vaccine. So as soon as I got the vaccine, I reached out to a couple of local organizations like one of the Plymouth Ambulance Clinic and ambulance organization, local fire, police department, like the township. And with the team of those guys, we set up like multiple vaccine clinic in the area, which each vaccine clinic, we used to do like 1,000, 2,000 vaccines a day. And so with their help, and we had like almost like 100 plus volunteers who up to those clinics to help out. And they're like the local guys who even I didn't know them, and they just kind of keep coming in and helping out and directing traffic and, helping out with making their cards. And so it was so amazing experience. And I'm pretty sure like there are so many guys like me who did vaccine during the pandemic had the same success stories like me. But what sets apart is like, what I'm trying to say is like, during this pandemic, all this stuff, what the independent pharmacy brought to the community, which is kind of different than all other pharmacies out there. What sets us apart is like when the community needs it, all the independent pharmacists rose up and stood up and took the challenge to, give our vaccines to all this community and, kind of make their life better. Versus, I'm saying like those things could have been done by the other chain pharmacists too, but I feel like the independent pharmacies have played a big role in during the COVID epidemic in vaccinating the people.
Yeah, I agree. We've heard so many stories about that, and I keep reiterating that, you guys you were the unsung heroes before COVID happened, and I think
that's what it is. Like the COVID pandemic kind of brought pharmacists into the picture that what we can do. Like before, honestly, we kind of seeing as just a pharmacy. Now they are seeing us as a provider that like these guys can do something better too. So now like more and more vaccines kind of coming our way that they see that like, if you give vaccines to the pharmacy, it's can reach out to the more broader audience than just a small part of the group. So I think that like the COVID pandemic kind of makes pharmacists a better person or like provider in the healthcare.
You guys went from being the unsung heroes to literally the heroes during that time, because you were the ones, like you said, you were the ones on the front lines when physicians couldn't get to patients, and doctors had trouble, and like you said, the chain pharmacies couldn't handle the influx, and you guys were there to kind of make it happen. So we definitely appreciate that. Well, I want to say thanks to Manzil for joining us on the show and for providing so much valuable information for our independent pharmacy listeners. Really love your passion, man. It's definitely coming through here, and I hope everybody heard that. Please continue to celebrate American Pharmacists Month, and thanks for subscribing to the Cardinal Health Counter Talk podcast. We hope you enjoy this show. If you haven't yet, make sure you subscribe and download the Cardinal Health Counter Talk podcast wherever you get your podcasts. See you soon in the next episode. Thanks again, Manzil, and take care, everyone.
Thank you.